Welcome back to the Career Series, everyone. Thank you so much for taking the time to catch up with Kessner. Today we have a resident physician, a graduate from Western University with her doctorate, an MPB undergraduate, graduate as well from UC Davis, and a friend that I met through Dance and Faith. So go ahead if you are thinking about medicine, if you're thinking about becoming a physician, or you just appreciate your healthcare providers in general, go ahead, follow, listen into today's episode, download. We both appreciate that. Dr. Michelle Pham or Dr. Michelle Lim. So Dr. Lim or Michelle Pham, thank you so much for taking the time today.
You're very welcome. Thanks for having me. It's so funny hearing the Michelle fam. I definitely go by Dr. Michelle Lim, but outside, no one's really asked me what I like to be called by, which is so interesting.
I'm still getting used to that, so we'll figure it out as we go. But
Same here, still getting used to it.
awesome. So before we get into all things medicine and healthcare, for the people that don't know who you are, quick introductions, Michelle. Who are you? What are you up to? We'll start off with that.
Yeah, my name is Michelle Lim slash fam, sometimes, however you want to call me. Um, I am girl born and raised in San Francisco, and I am also, like Kessner said, a resident physician. I currently work for John Muir Health here in Walnut Creek. I am a second year resident, which is crazy, in family medicine. So I see all ages from kids to adults
Nice.
and pretty much see everything under the sun. And that's the little short summary of me and my career.
Nice. Oh, that's awesome. Okay, so I'm gonna dial back time a little bit, Michelle, and we met through our Agape dance team back in college, and so I was very fortunate to, even though it was, a year or two of getting to dance with you and experience faith with you. Talk about how your faith continued to push you to dance while you're pursuing medicine at the same time, with dance teams such as V3 and Sodium.
Yeah, great question. Well, I think back in college, I didn't know I always wanted to do medicine. Um, I think I knew I was interested in science, and so I can get into that a little bit more later, but um, medicine wasn't always there. So I felt like, in terms of the stress level of wanting to do medicine in college, it wasn't there. So for me, I just knew I always needed some way to keep active. And so dance was pretty much like no questions asked. I'm going to do it. Ever since first year of college, freshman year, I'm like, I'm going to join a dance team,
Mhm.
and then joined one, and then later on, Agape was created, joined that,
Yeah.
and then there afterwards, when I went into med school, they always say your life is over once you do med school, or at least your social life.
Right.
You'll have no time for family, friends, which to some extent is true in terms of the time you are limited, but
Right.
that being said, you still need to take your wellness and your well-being
Yeah.
seriously, and so everyone would still advise all med students to at least take an afternoon for yourself to do something
Mm,
you love and something you
right.
enjoy. And for me, I found that even if I didn't do dance or do something that I enjoyed in medicine, I would have used that time on social media from Instagram, YouTube, and kind of waste my time. So I thought, what better way instead to do something I love and then use the extra time to focus on my studies. So it helped
Wow.
me actually concentrate when I do have the time to study.
Right.
And so that's when I decided, okay, I need dance in my life.
Yeah.
So then looked for a dance team. Eric happened to come across V3. And so we both auditioned, we danced for that team. And I think it was honestly amazing to be
Good.
part of a dance team through medical school, because for me it served multiple purposes.
Right.
Not only did it keep me active, it was something
Yeah.
I'd love to do, but it also gave me a sense of community and somewhere that's completely new to me when I moved down to SoCal for med school. um, and also very humbling because I think in medicine, it's very easy to be in this kind of circle and
Mm-hmm.
whirlwind and believe that, if I don't get this grade, my world is over. If I don't get
Uh,
pass or get this score, it will affect the rest of my career. It will affect where I will match for residency. And so every time I went to dance practice
yeah,
and I left, I felt so refreshed and so just calm afterwards, I guess is the
right,
word I'm
right.
looking for, in a world of medicine where it's very anxiety driving.
Yeah,
It was just amazing to have dance there for me to calm
right.
me and also be in a community that's not medicine related.
Yeah,
So then, you know, afterwards I'd be like, you know, life is still there. It's not all over
right, right,
if I get this score, if I do this bad, or if I don't pass this test.
there
So
you
it's
go.
really humbling in that way to also just give an aside besides medicine, and realize life will still go on and will still be there.
Right.
Yeah. So I
Wow.
guess amongst that too, um, it also left me to really trust in God
Mm-hmm.
because I could study and I could worry about it so much. But
Right.
at the end of the day, I realized I have to leave my studies
Mm-hmm.
and just trust that I will do my part and then God will do the rest. Um,
Wow.
yeah, that's my little story.
No, that's awesome to hear about your connection in terms of two different reasons, right? Or two reasons that complement each other. And the first one being that it's so easy to get caught up in the grind of medical school, and it's so easy to focus on the tangibles, right? Maybe that's the grade or the experience, and just making sure that you get the most out of the opportunity, right? I haven't experienced that in terms of going through medical school, but I can definitely relate to the idea of taking your higher education very seriously to the point where that's all you really think about from
Mm-hmm.
time to time. And in those scenarios, right, it's not to say that's the wrong thing to do, because taking your studies seriously is needed, but at the same time, right, it's very cliche to say, but the self-care aspect, right, what are you
Right.
going to take the time to do outside of your studies, outside of your education, that's going to keep propelling you to do the best that you can in school? And so for
Right.
you, moving down to SoCal, moving down to a new area, it wasn't even just about finding your niche outside of medical school, but it was also finding that community. And I love that, because we had a strong community back in Davis, but moving, graduating, right, you lose that. And I
Yeah.
definitely experienced that when I moved out of California, right, was where was my community going to be at? And I
Right.
struggled with that for a few years, and I'm still trying to find it now. But it's awesome that you found that, through Eric, or with Eric, through a dance team in V3 and Sodium, while still doing something that was really passionately yours, which was medicine, and
Mm-hmm.
also something that was dear to your heart, which was dance. So I think that's such a beautiful story to think about, or that you were able to pursue both things that you were love at the same time while still being new to so many different things. And it's just a good reminder that whenever we're pursuing a career, or whenever we're pursuing our passions, right, we don't need to always focus on that one thing that drives us. Like, what is the other complement to our lives that's going to feed into how we move forward, right? We don't always just need one thing. Maybe school is our one thing at the moment, but what's your side project? What's your side passion, right? And continue to do that, even though it may not seem natural at the time, or time allows it, or it's not the most feasible, right? Because if it feeds into your heart, that's what matters the most, right? Is it feeding into who you are? Is it feeding you to give more to other people? Because that's also really important when you talk about community. So at the same time, too, having a faith, that's also really important too, was that it was a Christian dance community, right? And having that understanding of, if I'm going to do this, if I'm going to devote my time into something that's really time consuming, really have to leave my hands up to God, and leave my faith in his hands, because I could easily, right, regret or come to this conclusion of, oh, if I didn't dance, maybe I could have done better somewhere else or in
Hmm.
some different area. So it's very natural to compare the two. But knowing that it was a dance or Christian community, you were able to, more easily acknowledge the fact that God's got me and God has always got me. Like he's a good father. And through my faith of pursuing dance, through my faith of pursuing medicine, knowing that this is your calling for me, God, then I know that you'll have my back in everything else because this is where you want me to be. And just to have that level of certainty or uncertainty, not saying that you were completely confident at the time, but just having this peacefulness, like you said, the word calm, and just knowing that after practice you felt so much better for yourself, and knowing that when you go to class and when you're going back into your studies, you just have something that you could always lean back on, and that was dance or that was your faith. And that's so I just it's just a beautiful thing to hear about.
Yeah, yeah, you summed it up really well. I think the Bible verse that I always think about and I
Mm,
always love to go back to is Matthew 6:34, the one about, do not worry,
there you go.
just focus on today, don't worry about tomorrow, because
Mm,
that already has its own worries. So
yeah.
me as someone who's just already have a high anxious level or anxiety level, and then medicine compounding on top of
Yeah.
that, um, it's just a good reminder to really just trust in God and leave it all up to
Mm, that's good. Always falling back on your faith is also really important. I love that, how that's something that you keep in your mind as you move on, because I'm sure it's so easy to worry about the future, especially while you're in medical school or while
Him.
you're pursuing medicine. It's so easy to fall into that trap, right? But when we let go of that just a little bit when we can, right? And just allow God to take the reins and let God to be in the driver's seat a lot of those times, right? Still working hard and still putting in our best foot forward. But at the same time, knowing that our support system isn't something greater than ourselves. I think that's
Right.
also something we could all, Christians and non-believers alike can really put their faith into something of a better ending, or a light at the end of the tunnel, if you were to say
Yeah, for
time.
sure. Definitely.
So thinking about your time in medicine or in medical school, I could only imagine how taxing that was, of how difficult, but also how fulfilling, right? Just knowing that you were doing something that you loved. So I do want to touch on, because you pursued a DO as opposed to a MD. Am I correct?
Mm-hmm. Yep, you are
So
correct.
what experiences did you really appreciate pursuing a DO degree at Western as opposed to, say, an MD degree, for example?
Yeah, I think this is a very common question that I get in terms of DO versus MD.
Yeah.
Um, so I'm going to try to keep it simple and short and
Nope.
short and
All up to you.
but I guess a little bit beyond that, just to explain the difference between MD and DO. So I would say the training is pretty similar. You have still 4 years. You still have your
Right.
preclinical years and then your clinical years. So we'll still cover the same subjects: anatomy, physiology, cardiology,
Right.
and whatnot. But I would say, in addition to that, for DO schools, you have what's called OMM, or osteopathic manipulative medicine, which is
Mm-hmm.
pretty much training with your hands. So
Uh,
in addition to all the other treatments and things that we learn in medicine, we also learn how do we treat this musculoskeletal issue with our hands. And so we have
wow.
200 plus hours of that in our DO school. So I think for me, something that I appreciate as a now family medicine doctor is
Yeah.
we have a lot of musculoskeletal um, complaints that come in.
Mm,
And,
okay.
low back pain is the number three top common complaint of patients who come in. So it's honestly just really nice to have that training and have that little, have OMM and have that in the back of my pocket to be like, hey, in
Right.
addition to this, I also have OMM that I could treat you with. So
Mm,
beyond, the typical ice, heat, physical therapy, elevate, rest. And of course medications, it's nice to be like, hey, I could try to treat you with this. So that's something that I really appreciate in my training. Um, and going back to it in terms of other things that I appreciate about
Yeah.
it, the med school is tough. You'll always
Yeah.
hear the differences between MD and DO and what
Right.
you could further pursue in the
Mm-hmm.
future. But I think as where I am in my career right now, that's something I really appreciate and another
Mm.
tool that I can use to help my patients. And I think
Right.
patients really do appreciate that too, knowing that, yeah, I want to be treated by you instead of like you referring me here, going to
Right.
physical therapy. And I think it really builds on the trust of the patient physician relationship as well.
Mm-hmm. I like that. That's good because like I'm not too well versed right in medicine. Obviously, I didn't study medicine, but I always like hearing people's responses of which specific degree or specific path they choose in healthcare because it really does come down to, especially if you're thinking about which degree to pursue or whether you want, like you said, pursue a DO versus an MD. It's always interesting to hear people's reasons of why they choose one or the other. Some people, right, have different reasons of why they're pursuing, and some people do it for the experience, right? Because they offer two different experiences, like you said. One has offers different skills in the end and different experiences in OMM, for example, and others focus on other things. So I think it's just really interesting for someone that maybe not just myself, but for someone that's new to medicine, new to healthcare, and just wanting to understand which path they want to take. It's really important to identify, well, what experiences do you want to get out of medical school, because
Mhm.
each school will offer their own experiences. Obviously, in a previous interview with Darren, for example, he at Illinois, he's really loving the idea of medicine along with engineering and how they both really complement his interest in that, right? So when choosing a medical school, when choosing um, a degree to pursue, it's really important to figure out, well, what do you like? What are you passionate about? Or not even just what you're passionate about, what are you really interested in getting out of the experience? Because like you said, you'll get the same training, right? The same general courses over the course of the 4 years. But outside of that, once you finish that, what matters to you? And I know a lot of pre-med students want to get into medical school first to understand that path, right? Which direction they want to take, and maybe it's not so clear to them at first, but at the same time, it's always good to know what you want to get out of it so that you can have a better idea of where to apply to and how to apply and all of those wonderful, wonderful, taxing, strenuous questions that you have to go through, right? But
Uh-huh. Yeah. No, exactly. And I think that's a great point that you have. Um, because for me, as a dancer,
mhm.
musculoskeletal issues was always, I don't know, important to me, and it was always
Wow. Okay.
an area of interest, right? We go
Right.
to practice and we have like this shoulder injury or we have this back injury, and so
Right.
I felt like as someone who maybe used to be more active back then, can't speak to COVID times as much.
That's true. That's real.
But muscle issues is such a huge deal, and so it's really nice to be able to at least know more about it and be
Mm,
able to talk to people, and think of different exercises or different ways to treat it,
right.
and going a little bit more back into DO versus MD, I think in knowing that I wanted to do and pursue family medicine, it was a pretty
Right.
easy choice. But um, if I were to direct someone or advise someone more seriously into medicine, depending on what field they want to pursue, I would then
Right.
advise them, okay, maybe MD might be the better route for you as opposed
Mm-hmm.
to PO. But at the end, you're going to be a doctor. And that's
I
the number
know.
one thing they tell you. They don't really see the difference between MD and DO. They just see you as a doctor. So if that is your ultimate goal, you know, I'll just apply to all med schools, you know.
That's good. That's good advice. I mean, two things I love about that was I love how you mentioned that it complemented your experiences and your appreciation for dance, right? Because dance is all about muscles, right? It's all
Mm-hmm.
about activating the right muscles at the right time. And for you to have that experience already and that passion, most importantly, that interest in, that community or that sport, right? You could really take those into heart when going through DO school, and I think that's really important to acknowledge too. Is that it doesn't always need to be a fine line of what do I like in healthcare or what do I like specifically in medicine, right? Think of your interests outside of that, the broader picture of it, and what do you really hold dear to your heart? What do you really appreciate? What does your outside of school time look like, and see if you can find that in a way that complements your direction in medicine. So for you is dance, and for other people it's other things. And like you said it very well. Depending on what your interests are, the DO versus MD conversation, for example, is it's going to be more tailored toward that. So that's also really important to recognize. I love that. That was great. It makes me want to pursue healthcare. No, I'm just kidding.
Do it. Just kidding.
It is a thought that I once had. So in previous podcasts, if you've listened to previous podcasts, everyone, I've talked about that I once considered a career in medicine, but
Mhm.
God has called me towards teaching at this time in my life. So that is why I'm here.
Yeah. Well, you're always welcome. Healthcare will always be there.
It's true.
And I
They
do a
are
lot
not
of
too
teaching.
different.
They're not. I feel like I do a lot of teaching in family medicine too. So
Right.
I think there's a lot more similarities than most people think. So,
I like that. Maybe we can do another podcast on that.
yeah. Down.
So thinking more about your faith, because I've always appreciated, honestly, when I think of you and Eric, I just always appreciated the love that you two had, not just for each other, not to get cheesy with that, but also just the heart that you had for God and your faith, and really using that as a way to build community, using that as a way to build relationships, and just being really good role models. I think I've talked to Eric this a few times, but I just always appreciate you two as, you know, older role models, not even being that much older, but just being, two people that I really resonate with in terms of your love for, Eric's love for teaching and your love for dance and faith and just your love for medicine too, right? Just all these different aspects of your life. I really do look up to you. So I am curious of where did you find your faith really being tested, or how do you find your faith being really tested and challenged at being a resident physician, especially during a time like this?
Oh yeah, that is a great question. Um, you know, it's always tough. I will say my underlying thing that I say is there's always three things you don't talk about, right? It's
Okay.
religion, money, and politics, something like that.
Right, right.
And being in medicine, it's really tough, finding that boundary to have that conversation with other
Mm,
people.
definitely.
And there's already just some things in medicine that I feel like people have a lot of hesitation, have a lot of defensive walls there.
Mm-hmm.
If I were to bring up religion, if I were
Right,
to bring up someone's gender preferences, it's always
right.
the question, just because it's coming from a doctor, like, oh, are you judging me? Why are you
Mm,
asking this question? When in reality, I
interesting.
feel like it should just be a foundational, like, hey, I just want to get to know you. I want to
Yes,
respect you. I want to respect your preferences. Um,
definitely.
and more about even end of life care, something that we've learned is a lot of people do have either religious or spiritual preferences that doctors never ask them about. And I think they've surveyed people and they wish that their doctors actually did ask them about it because it's important
Wow.
what they want, you know,
Yeah,
in terms of their goals, in terms of, how they want to their end of life care to look like.
right.
And so I guess more talking about that, I find my faith, I don't know if the tested is the right word, but it's brought up more in having those
Mm,
conversations.
okay.
And I just wish it wasn't such a topic that we had to hide from each other. It would be
Yeah,
great if we could just have those open conversations, be like, hey, are you Christian? Are you Catholic? Are you Buddhist? And
yeah,
just be open about it.
right.
Um, and not have to have those either like stereotypes or
Mm-hmm.
judgment already towards those people.
Yeah.
Um, so, in terms of direct conversations, when I talk to patients about religion, Um, I can't have that direct, like, hey, I'm Christian. I want to
Yeah.
be open and just share my experience of how great God is and just,
Yeah.
you know, like join my community. Like,
I
I want
know.
that you know more about Him, but it's more so expressing it in the way that, I am here for you and
Mm-hmm.
showing it more through my tone, my compassion, providing
Right.
empathy for my patients, and knowing that I am here for you, which in turn, you know, is just the way it comes across through your actions and your words, as opposed to like
Mm-hmm.
directly like, hey, I'm Christian,
Yeah.
through that way, especially in medicine, which is
Mm-hmm.
always,
Right.
just a different field to be in. I
Mm-hmm.
think in this world where we're turning more modern and
Yeah.
we're being more expressive and open, I feel like medicine is lacking a little bit in that area. There's still that hierarchy,
Mm.
unfortunately. And so we're breaking it down little by little, with
Right.
more female providers.
There you go.
But we still have a lot of ways to go in terms
Yeah.
of breaking out that hierarchy, having more
Mm.
open conversations. Um,
Mm.
yeah,
That's good. I really resonate with that as a teacher too, because it's not too different when you're in the classroom, for example, right? When there is that the don'ts of what you're supposed to do in the classroom, right? You're not supposed to talk about religion. You're not supposed to really test people in their politics in the classroom, right? You want, but in the sense, I love how you said it. It's about the framing of it too, right? Because you learn so much about people through their faith. You learn so much about people through their political views, and not out of judgment, but it's merely out of, if I'm going to provide the best support for you, if I'm going to provide the best care for you, it really comes down to me knowing what are your values, how do you want to be cared for, and how am I
right,
going to relate with you at the end of it, right? And
right,
so when you talk about family medicine, a lot of that is really coming down to relationships and teachings like that too, right? But it's hard to cause this or have this conversation, right? If there is this dissonance between what I can and cannot talk about, when at the same time it's contradictory, because you want to know your patients, you want to know their lives, and you
exactly.
want to know what's meaningful to them and what matters to them, especially when you talk about, end of life care. And all of that is something that you need to know, right?
Exactly.
Especially if your life is dedicated in serving your patients. You need to know that information. So I
Right.
like how you mentioned that there's still a long ways to go of making sure that this conversation or these types of conversations become normalized, because right now I guess it's maybe not normalized in the field of medicine, or maybe it's not normalized in the field of education, where the intentions of most people is we're asking those questions because we want to know who you are, and then
Mhm.
from there we can meet you where you're at, we can provide you the care that's really most meaningful, and we don't have to assume, right? Because we come from a lot of places where maybe assuming might be natural, right, for the ways that we've been brought up. But then at the same time, it matters that we get to know the people that we're serving, like
Yeah.
100%. We need to know the people that we're serving, and whether that's through family care, that's whether through that family medicine, like it really comes down to your relationship, and relationships are just that much more important, right?
Mm.
So I love how you recognize that's something that needs to be broken down over time, that it's, maybe it's being tackled now, but maybe through more voices and more advocacy, and just more of a stronger front of saying, we need to have this, right? We need to have maybe more women physicians that are willing to talk about X, Y, and Z, or just, any type of physician that's willing to put the patient first, outside of the politics of it, outside of the institutions of it, right? The different conversations that could come up about it. It really comes down doctor patient relationship. It's just the
Yeah,
fundamentals of it, right? So that's just really
exactly.
important. I love that.
Yeah. Like, for example, it's funny because the first thing I say is, hi, I'm Dr. Lim, nice to meet you. And
Mm-hmm.
then it's so important to know how to address you. Do you like to be addressed by he, him, or do you like
Yeah,
to be addressed by she, hers? And,
yeah,
it's that am I automatically going to address you by my assumption? And I would rather not
right.
assume, or you tell me
Of
what you
course.
want, what your preference is. And so I think it's just so important to have that conversation.
And that's a good point too. You just reminded me of normalizing this conversation so that patients understand where you're coming from too, right? Because maybe there is that assumption on the patient's part of, why are you asking me, right? Like,
Mm-hmm.
shouldn't that be obvious? For some people, that may feel very strongly about who they are, they may take that the wrong way from you asking. But maybe through time, right, this idea of normalizing respect out of others, normalizing appreciation for everyone for how they are. And with that comes the question of, what do you prefer me to call you?
Yeah.
And that's really important too, of just inclusivity and, making sure that everyone feels a part of their community and very comfortable in their own skin, no matter race, gender, culture, and especially through medicine, right? Especially through medicine, where a lot of those you know insecurities or a lot of those education comes through conversations that you have with your doctor, and that exploration of being comfortable, especially with family medicine, right, where you're seeing a lot of the same families or a lot of the same patients. It's good to just build those types of conversations to have the most holistic and most appreciative experience. So that's good to note.
Yeah, I could talk about this ever in terms of like, the forms we
Mm-hmm.
fill out, we have you
There you
fill out.
go.
It's already just like male or female, but it's like that's already biased. Why can't we add another
Yes.
topic? Um,
Right.
and then, yeah. Oh, I could go on forever, but I'll stop there.
Sure. No, we'll have another podcast on that.
For
But
sure.
all right, so Michelle, we've talked about faith, we've talked about your journeys with dance, we've talked about your passion and your wonderful heart for healthcare. I'm going to put you in a situation and I just want you to respond and tell me your thoughts. Okay.
All right.
So you have the chance to time travel 10 years from now and end up at some random point in time 10 years in the future. What do you
Mhm.
want to see in yourself and what do you hope for yourself and why?
Mm, 10 years from now, I hope that career wise, I will still love what I'm doing. I hope
Mm-hmm.
I'm not too burnt out. I hope that I have strong patient physician relationships with my
There you go.
patients.
Yes.
Um, and I hope there's a COVID vaccine and I hope everyone gets
Yeah,
it in
that's
addition to
true.
flu vaccine. But that's another time. I
Yep.
think outside of my career too, I just hope that I have continue to have this strong relationship with you and the
Mm-hmm.
rest of my friends, including
Yeah.
people from Agape.
Mm-hmm.
Hope I still have a strong relationship with Eric, husband, um, and in addition to my family as well. I would just love to be able to have some sort of home where I could just invite
Go.
everyone and everyone could just come
Yes.
together,
Yeah.
hopefully post mask time, and just enjoy each
Yes.
other's company and just share all the stories like this one with
Mm-hmm.
each other and just continue to learn and grow from each other.
Awesome. Right. It's so easy to think of the negativity that's happening right now. It's so easy to focus on what we don't have or what we're unable to do. And so I pose this question because it's a good reminder that 10 years our life will look a lot different. It could be a lot of
Mm,
same in some areas, which could be a good or bad thing, but it's also this idea of staying hopeful for a better future. And I love how your emphasis was in community, your emphasis was in friends and family and your husband, right? Just making sure that your future 10 years from now is really centered around the people that you care about. And
yeah.
that really attests to who you are, Michelle. I always appreciate how friend or family oriented or relationship oriented you are, and just your heart for the people around you and the heart of the people that you serve, which makes you a wonderful physician.
Thank you, Kessner. I appreciate it. So many good words coming my way. I really do appreciate it.
No, the thanks is all mine. For everyone listening, thank you so much for tuning in today. Michelle, thanks again for out of your busy schedule. Thank you so much for
You're
taking the time to
welcome.
catch up with me.
You're welcome. Thanks for having me. I really appreciate it.
Cool. Until the next time, Michelle. I'll see you.
Yeah. See you.
Bye.